reassessment of the patient. I've examined what their movement patterns are like, and perhaps from the history, from the movement patterns, what seems to have centralized their symptoms or movements more towards extension. Very often these patients will benefit from an unloaded position, which in our case means in a prone position. So the patient, first of all, may just assume a prone lying position. Some patients will have found this out intuitively, that lying on their stomach helps reduce their symptoms, but they may not know how to proceed from that point. So our job is really to help them not only temporarily centralize, but permanently centralize and abolish their symptoms. So starting out in a prone lying position, I'm going to question the patient about the location of symptoms. From there, if symptoms are still present, I'll ask her to come up onto her elbows and kind of prop. At this point, I'll reassess, have that changed any of the symptoms, the position of the symptoms. So for example, if the symptoms previously in a prone position have been extending to the knee, the prop position may have reduced the symptoms where they're just being experienced into the buttock area. From there then, if that doesn't change after 30 seconds to a minute, then I'm going to progress the force further. I'm going to ask the patient to come back to neutral and put the hands underneath the shoulders and then push up the upper body while keeping the pelvis on the plinth there. Good. Back down again. And if you can just keep your head kind of looking towards the ground. We'll just do a couple of those. Excellent. Back down. A few more. Keep going. So if the patient naturally has a lot of lordosis, it may be that this movement won't get her to end range. So I may need to adjust the position of the plinth. I may need to bring her hands up a little bit. Maybe have her bring her hands back underneath her here a little bit more, and that way she can get further into end range extension where the pelvis is starting to lift. Relax. Again, if the patient says that feels good during the movement, it seems to be affecting the symptoms, reducing the peripherally movement of the symptoms, I can even apply overpressure by just stabilizing the pelvis. So I'll let you come on up into extension. Good. Push, push, push. Yep. And keep going. Back down again, and I'll have you go 2 or 3 more times, and maybe just a fraction faster. Perfect. Back down. Excellent. All the while monitoring the patient's symptoms. Are they changing? Are they reducing? And as we progress through this extension force progression, would you relax? Would you turn that off for a second? In the case of a patient who has not responded to a sagittal plane progression, in our case very frequently we use the extension progression, we may need to reduce down or alter the movement on one side. What I'm going to do, if this was a patient who had symptoms that tended to be biased over to the left side, the left buttock, or into the left limb, what I'm going to do is I'm going to have you shift your hips away from me, kind of make you banana shaped. Take you this way a little bit. And then what that tends to do, that tends to compress the segments or the structures on the left side. Now what I'll have you do is I'll have you do an extension exercise, a push-up exercise again. Good. And you may need to keep your hand out a little further. It's going to be a little harder to get up when you're in this banana position. All right, let you come on up. Good. Back down again. So again, we're doing the same extension maneuver, but this time with closure on the left side where the symptoms are. So I have the patient repeat several of the movements, assessing as she goes whether or not the symptoms change. If I feel that I need to apply some more overpressure, I can do this. Come on up. Back down. So that's the case if the patient is moving or shifting. And back down and rest. So again, I would move the patient to this lateral position if the straightforward extension in the sagittal plane were not affecting the symptoms in a positive direction. Okay. Right. The thrust manipulation that we're going to demonstrate next is for the lumbosacral region. It's a very non-specific thrust manipulation. It can affect